Epistaxis by Annie Bettis Walker for Auburn University. What is epistaxis? Epistaxis is severe bleeding from the nose, nasal cavity, or nasal pharynx. It is a symptom, not a disease. The why. Nosebleeds are most commonly caused by idiopathic reasons, nose picking, bleeding tendencies such as anemias, leukemias, and decreased platelet and clotting function, sinus infection or upper respiratory tract infection, nasal congestion, uncontrolled hypertension, hepatitis or other liver disease, trauma, dry nasal mucosa, alcohol abuse, blunt nose trauma, and foreign bodies. Some other risk factors include cocaine use, dry climates or winter months, septal deformities, long-term use of anticoagulants, infants who suffer from GERD, and those who suffer from sarcoidosis or Wagner's disease. Some questions to ask. Are you currently taking anticoagulants or blood thinners? Have you been diagnosed with hypertension? If so, is it controlled? Have you recently experienced any type of trauma to your head or nose? These questions can help to determine the etiology of the nosebleed. The cause of the nosebleed will determine the treatment required, and if trauma was experienced, patient may have to be referred for further treatment. The incidence of nosebleeds is most common in children younger than 15 years and adults older than 50. It's rare in children less than 2. Peaks in ages 3 to 8, more common in boys and men, dry climates, and winter months. Some physical components to examine. Examine the nostrils. You would expect to find nostril hemorrhage, dry blood, or trauma. Anterior bleeds are the most common and can be identified if bleeding is active. Epistaxis can be confused with hemoptysis, hemoemesis. Therefore, blood dripping from the posterior nasal pharynx confirms a nasal source. Need to examine the skin. The skin may show evidence of bruising or petechiae that may indicate an underlying hematologic or abnormality. Assess vital signs. High blood pressure can cause nosebleeds and can impede clotting. Tachycardia can be an early indicator of significant blood loss, requiring replacement, IV fluids, and possibly transfusion in blood. Differential diagnosis. Because epistaxis is a symptom, not a disease, the underlying cause must be determined. You can have nasopharyngeal or sinus tumor, chronic sinusitis, or epistaxis. Diagnostic studies. Usually no studies are performed. If bleeding is severe, evaluate for anemia and platelet count with the CBC. Clotting studies as needed, and you may need to assess liver function tests. The non-pharmacologic management, ice packs over nose promotes hemostasis. Have the patient sit upright, apply pressure by squeezing the nares and tilt the head forward to prevent blood from reaching the posterior pharynx. Teach the patient how to properly apply the pressure to the nose. You may use nasal endoscopy for cauterization, nasal packing for anterior bleeds, surgical cauterization or arterial ligation for intractable bleeds. Pharmacologic management, analgesics as needed, phenylephrine spray or Afrin for temporary vasoconstriction, vasoconstrictor or impregnated cotton, silver nitrate cautery with silver nitrate stick for anterior bleed if the area is visible. Referrals for severe anterior bleeds, all posterior bleeds, and recurrent bleeds, consult ENT. For nosebleeds in older patients or the elderly, consult ENT. Follow-up and expected outcome depends on the etiology and the severity of the bleed. Prognosis depends on the etiology. For idiopathic nosebleeds, the prognosis is excellent with proper treatment. Priority teaching components. Patients should avoid hot and spicy foods and drink plenty of fluids. Avoid strenuous activities, hot showers, and digital trauma. Avoid hot and dry environments, nose blowing, and excessive sneezing. Provide drug education related to use or accidental ingestion of aspirin, warfarin, or drug abuse. Educate about digital trauma, especially in kids. Keep the nails well trimmed. Each of these components will help to alleviate further nosebleeds.